Waiting for an appointment to see a public dentist in Queensland can take anything from a day to a decade. It's a problem that keeps festering as the population grows and private services become less affordable. The Health Minister admits an ambitious and innovative approach is needed to slash waiting times, but patients are growing weary and want solutions. Francine Norton reports.
Jim Alexander has time to smell the roses now that he and his wife are retired.
There's a nice little bud coming through.
But he's running out of patience to have his 15-year-old dentures replaced, and going private isn't an option.
I'm on a pension and I find it's going to cost me probably $2,000 or $3,000 to get dentures at a dentist. I've been on the waiting list at Stafford since November 2009. That's when I first got on the waiting list. And they told me it would be a good 2 years before they'd be actually doing anything with my teeth.
My bush is coming on really well.
Jim Alexander is one of more than 110,000 Queensland adults languishing on the public dental waiting list. Many are turning to the University of Queensland's dental clinic in Brisbane, where increasingly students are filling the gap.
Certainly we see more healthcare card holders because of that, because of the well-acknowledged delays in the public system currently, so people can get in here very quickly as opposed to how they may have to wait in a regional clinic or even a Brisbane clinic.
UQ's Dr Brad Wright is also the Australian Dental Association's state president. He says in the long run, students are not the panacea.
The current system isn't working, and I don't think many people would disagree with that, despite the best efforts of people in dentistry and people in the public health system. It is clearly under-resourced. We have a very regional state with a very distributed population, and getting resources, no matter who is doing it, to those particular areas is quite difficult. Also, the number of people that qualify for reduced fee treatment or healthcare card holders has expanded, and clearly the oral health services have not expanded to meet those demands as time has passed.
Queensland health figures show that of those on the waiting list, people needing emergency dental treatment waited just 1 day. But patients needing to replace lost fillings or fix a broken tooth waited 44 days. For a simple checkup and clean, the median wait was 786 days. Those patients accounted for almost 90% on the waiting list.
What we have at this point in this state is a system that is collapsing around us. We need a strong, effective government and also a strengthening policy to deal with the issues that we are now facing.
The government doesn't publish regional breakdowns, but the ABC has found the queues vary dramatically across the state. In Toowoomba, the wait for a checkup is 4.5 years. In Bundaberg, it's 8.5 years.
I believe that figure will get worse as time goes on. And the reason is this: Queensland Health can't retain dentists. They don't have a retention capacity to keep young people working for them because they don't pay them enough, they don't have a career path, nor is there a casework mix for them to work through and enlarge their skills.
And also some of the old-fashioned ideas, such as a bonding system where students actually graduate as they do in teaching and other professions, and then are retained to work in provincial areas for a period of time to gain points to return to the city. Those two things would go a long way.
Jeff Wilson says he's bringing an open mind to his role as Health Minister and is keen to canvass innovative ideas to retain staff.
That's a challenge, there's no doubt about that. You will find that's a challenge across a range of professions that work in the public sector. Indeed, in many professions, it's not possible in the public sector to ultimately compete with what is being provided and offered as pay and salary in the private sector. What I'm keen for Queensland Health to do is to examine the opportunities for collaboration between the private sector and the public sector in the dental health area to maximise the advantages of both.
But the Minister says the opposition should shoulder some of the blame for the backlog.
About 2 years ago, the federal Labor government proposed to give Queensland $50 million to help improve the numbers of people who could get access to public dental health. The LNP senators in Queensland blocked that in the Senate. Now, that $52 million never got to Queensland. If it had got to Queensland, we could have provided about 187,000 treatments.
Understand this: if they had supported that bill, It would have cut funding to people who are chronic disease sufferers getting dental treatment. Now, those with chronic diseases are ones who come back to hospitals and dentists over and over and over again. You're taking with one hand and giving with this other hand.
Oh, hi, honey.
Jim Alexander isn't interested in pointing fingers. He just wants to move to the front of the queue before the pain sets in. Until then, time is all he has.
I can't do nothing about it. I've just got to wait. As simple as that. I've just got to wait my time. Yeah, there's not much I can do. Just be patient. Test to the patients.